Welcome to Your Way Now. We're Sue and Sarah, coaches supporting people living with cancer and those moving beyond it. Each episode shares real stories, expert insight, and gentle tools to help you feel more supported, physically, emotionally, and mentally. This is Your Way Now.
Get the strength you want and need from real stories and expert voices. It's time for Your Way Now.
Hello and welcome to another episode of Your Way Now, the podcast, with me, Sue Brown, and my colleague, co-host, Sarah Hurst.
Hi.
We are delighted to welcome today Anna Joseph, who is an acupuncturist and does amazing work with cancer patients in Sussex. So we're very much looking forward to hearing all about that and what it does for people. So where would you like to start, Anna?
Oh, where do I start? Well, thank you very much for inviting me on. This is my
Pleasure.
first podcast, so forgive the waffle if there is any. Yeah, well, basically, I'll just give you a little background, shall I?
Yeah, please.
I'm a trained nurse. I've worked in oncology and specifically chemotherapy for 15, 16 years now. And it was in that job, really, seeing and supporting people with so many horrible side effects related to treatment, that when the opportunity came up, or when I met someone who had trained as an acupuncturist, one of the oncologists actually, that was really inspiring to me because I thought, hold on a minute, this could go really well alongside conventional treatment. And I still think at the time, maybe 12 years ago, it was seen as a bit out there for NHS to be supporting this. But actually, given that an NHS doctor had trained in it, so he encouraged me to do it. And I went up to London, did the medical acupuncture training for nurses, well, and doctors, physios, anyone. But so did that, and then met a wonderful doctor on the course, and we set up what we call CBAS, which is a community-based acupuncture service for oncology patients, which is funded by Sussex Cancer Fund and hosted by Macmillan in Brighton. And that is the service that I run alongside still doing my chemo job. So it's lovely. I get to do the treatment that is obviously really necessary, but then when there are side effects that, we don't have to necessarily throw more pills down people's throats if there's another option. And people are feeling fairly toxic after a lot of treatment. So it's lovely to be able to offer something that isn't that. So they can have that through Sussex Cancer Fund. Six free sessions.
Okay. And what kind of things do people come to you with?
Yeah, so I'd say the majority of people come with symptoms related to drugs that cause what we call vasomotor symptoms, so hot flushes, but also joint pains and aches related to hormone treatments. If people can't have estrogen or testosterone because of their particular cancer, they might be on drugs that block those. So they cause a whole array of side effects. So we see people coming in who really are quite stuck because they can't take HRT, and it's banged on about which is a great thing for some people, but not for everyone. So there's this niche of patients who really, really want to stay on their treatments, but might consider stopping them because of the side effects. So I would say that's the majority of people that we see, but we also see people who are going through chemo with high levels of anxiety, obviously, potentially insomnia, pain, so musculoskeletal pain, it's very effective for as well. So it can work on sort of local areas of pain, say, for instance, inflamed joints or scar pain, but it can also work on the central nervous system as well, on your autonomic nervous system. And that's what's lovely, because that's more of a general regulatory effect of the acupuncture. So even if someone thinks, well, I'm not sure if this is going to work for me, there might well be something, not their obvious issue that they came with potentially. It might help with something else. So it's
how do you find the results generally? Is it really amazing?
Yeah, I'd say about 75% of patients who come in with hot flushes get a reduction in intensity or frequency, and that's within, say, the first 2 or 3 sessions. So it's really good to have a block because the body needs to sort of be retrained. To have one session can sometimes be helpful, but the course is quite useful. So people are shocked, and I'm still shocked every day at how effective it can be. But quite often, you might have someone coming in who's quite skeptical because it is an amazing and in some ways still unknown treatment of how all the different ways that it works. But they might come in and think, "Oh, I'm not sure this is going to work," and then it does, and it's lovely.
It sounds like most people have never experienced
Yeah,
acupuncture
exactly.
before, so it must be amazing to work with them and see their sort of relaxing or
Yeah.
feeling better and realizing that actually what you're offering is something that's really powerful.
Yeah,
And
absolutely,
they
and
can
I
go
think
away with
we've
that.
really moved more and more now from being an alternative treatment to, something that can be really, complementary, and I think obviously there is the distinction between the 2. There's Eastern medicine, which is more focusing on Eastern acupuncture, which is focusing on meridians and unlocking energy and releasing energy and calming down heat and damp, etc. Um, I'm trained in Western acupuncture. We're both trying to achieve the same goal. We're just explaining it using a different framework. And my approach is rooted in a medical model, but that's not to say that any acupuncture can be useful, just as long as you're with someone who understands oncology as well, I think.
Yeah.
What's the difference with, you mentioned what Eastern, sort of acupuncture is. What's Western acupuncture?
Okay, so it's much more, as I said, rooted in a scientific medical model. So we explain it using neurophysiological explanation. So working on the needles going in and stimulating nerve pathways to release things like endorphins, serotonin, dopamine, all these endogenous things that are released in your body anyway. So what's incredible is that really it's just the action of the needle stimulating what is already produced by your body. So that has localized pain and anti-inflammatory effects. In the case of hot flushes, messengers are sent to your thermoregulation center in your brain, and that helps to balance out temperature imbalances. We can work on scars, working around scars with needles to help more blood flow and healing there as well. So that's useful post surgery. So there's sort of multiple ways it can work. As I said, a lovely byproduct of even if you're treating one thing, the whole body will benefit from that relaxation and from time
Response.
out
Yeah.
and just stopping. And I think that's what I love about it is that it's a opportunity in a crazy busy uh, cancer pathway where people, staff, including myself, don't feel like you've got enough time to spend with people. This is a lovely set of sessions that you can really work with someone, listen to someone, build a really lovely relationship, but also have a treatment at the same time. So that's why I enjoy it so much.
Fantastic.
Yeah, I mean, I know for me, anything to do with the calming the nervous system is obviously massively beneficial and that
Yeah.
whole slowing down process. And I have to say, I noticed in myself that if I'm calmer and less rushing about and everything else, that I think my nervous system regulates my hot flushes, so I don't get as many where I can almost tell when it's almost like my signal that I'm a little bit stressed
Yeah.
because my hot flushes increase in frequency.
Yeah. You're absolutely
And when I'm actually nicely calm, then I really don't notice them at all.
yeah. Yeah, you're completely right. People come in and say, "Oh, what sort of triggers?" "Oh, I've noticed that when I'm stressed, they really ramp up." So what we do with the sessions is that if people do respond, there's a very small percentage of people who won't respond, but I still think it's worth giving it a go. Is that maybe after a few of their sessions, if they feel able to, we can teach people how to self needle.
Oh.
So, and even though you might have had a lot of needles in your whole cancer experience, these are the nicest needles you'll come across because they're very small, very thin. And if that's too scary for you, then we could also have little studs that we can use instead that just have a minute needle on the back, or even just acupressure. And there are certain points on the ankles, there's some on the chest. Um, and that can be a lovely way of continuing sort of the benefit of the treatment by massaging those points yourself. So you're getting a little bit of acupuncture until maybe you can find time to go for another top-up session or and it's great to empower patients to do stuff themselves.
People do that in between sessions with you as
Yeah,
well, so they
exactly.
can sort of like
Yeah,
learn sort of self-soothing things that they,
exactly. Yeah.
yeah.
So
Go on
there's
then,
some
give us a
lovely ones.
demonstration.
Sorry.
I said, go on then, give us a
Yeah.
demonstration.
Okay. So there's 2 points that sit on the chest here. So they would probably be a couple of seeds just on the sternum, on that nice big
Knobbly bit.
breastbone, sort of there. Come down your clavicle, and then just below there, on it's called a manubrium, and just gently massaging round like that. Um, we place some small stickers on there which have tiny needles on the back, but you could just get a plaster with seeds. And these points we call in our medical acupuncture world the ASAD points, which could be, some people call them the all singing, all dancing points, but it also stands for anxiety, sickness, and dyspnea, dyspnea being breathlessness. So for
Okay.
cancer patients who are struggling with any of those things, just having these 2 points here, and it's a really lovely grounding thing to do, to massage this, but it also has physiological effects as well. So
Amazing.
they're
Really
great ones.
soothing. I can
Yeah.
feel it. I mean,
Mm.
I'm like feeling
Yeah,
quite
it's coming
sleepy now.
down, yeah.
There you go.
But
Um,
that must be lovely because we were talking earlier, weren't we, about anxiety and how much of a real
yeah,
thing that is, no matter where you are, whether you're in remission or still going through active treatment, that it is such a thing. So it's it must be lovely to be able to pass on that simple
yeah,
trick that people can just bring their anxiety levels down. And
yeah.
so important. That's why we're doing this, really, isn't it? Because
Well,
that's the kind of things
absolutely.
that you
Because we
want to be
had
able to pass on to people.
because if people want to sort of look back at episodes, we did a great conversation with Louise Baker, the neuroscientist, and she's got quite a lot of soothing tools as well. So if anybody
Yeah,
wants to look back, it's a great one. I think all of these little tools that people can use themselves very simply are just really effective for
yeah,
people.
yeah, definitely. The other ones are the hot flush points, which are on the ankles, and they are just little sticky points that stay on even through showers, bathing, whatever, and people can use them regularly. We would say massage them twice a day, if not more. And like I said, that can just keep people going until they might need to come back for another little top up
Yeah.
if the symptoms raise their head again. So
So by the end of 6 sessions, if you have somebody coming with hot flushes, that you can usually get that to a
yeah,
manageable state where people
we
are a
can't
bit
promise
more.
we're not gonna
No.
completely eradicate them because you're often fighting against the effect of the medication, but, we do have some groups actually, and they've been brilliant because, it's a way of continuing on treatment. You can see more people at one time, people can share experiences or what's happened, what drug are you on, what have you found
Okay.
helped? So people would all sit in a lovely relaxing chair, and then we do all the needles, and they get to have a top up, but we can manage to see more people that way. So that's another thing. There's quite a few
Oh,
multi-bed clinics around Brighton, and Hove, so that's always an option for people to keep costs down and have acupuncture, make it more accessible to more people. Really,
yeah.
that's
Yeah, there's loads of advantages to that then, isn't there,
yeah,
to having
exactly.
that community as well of people going through a similar thing.
Yeah.
And do you know if this is a widespread service that's available for people nationwide, or is it really, do you know if it only has a local sort of Sussex service at the moment?
Do you know what? Our service is actually quite unique. There isn't, as far as I know, another nurse-led service like this,
Okay.
um, and we've just been really fortunate to have the charity support that we have had. What I'd really hope one day is that the NHS really does embrace it more, and that it's accepted by NICE as a recommended treatment, really, because at the moment medical acupuncture is only recommended for migraines and lower back pain, but we know that in oncology there's so many benefits.
Mm.
So there is more and more research coming out all the time and much more evidence base to support that. But we're very lucky in Brighton that we've got this. And as I said, we've got our Brighton service. We also have expanded out to Eastbourne, and we're hoping to set up in Worthing too. So then we'll have a nice spread across
Good. Yeah.
Sussex
Yeah.
for hopefully more people to access.
Amazing. And how do people access it? How do they
So they would
find
have
it?
to be referred in by a clinician, and that could be their oncologist or a specialist nurse or a chemo nurse. or they can just pop into Macmillan and say, I've heard about this medical acupuncture service. Could you refer me? And there is a form to go to be filled in, but that has to be done by one of their healthcare workers, and then they'll be contacted to see if they're eligible. Nearly everyone is. There's not really any contraindications, and we can always work around anything that people might think might be an issue. But yes, it's generally a really safe and accessible treatment, I think.
You also have a private practice as well, don't you?
Yeah, just set that up last year. So I've got a private practice on the cusp of Hove and Portslade, and I practice there every Thursday. It's based in Hove Osteopathic Clinic, and it's just Anna Joseph Acupuncture, nice and simple. So people can come along there, and I offer packages. Again, a set of treatments or individual treatments, whatever you like, really.
And how frequently would normally people have these treatments done? I'm not sure if you mentioned that earlier or not, did
Yeah,
you?
so if someone were to come in and they really did have quite intense hot flushes and joint pains, and they'd really been hit hard by being started on one of these medications, I'd probably say if they could, it's best to try and start weekly for at least a month, and then we can start increasing the interval between the treatments. But leaving it any longer in between just means that, you're not getting those pathways re-educated as we need to. So if
And do
people
people react differently to the treatment? Some
yeah,
may recognise a change in themselves quite quickly,
yeah,
but does it take longer for some than others, and you just see
yes, it
different
does.
things
Yeah.
coming up?
Yeah, I've had a few people who said, "Well, this isn't working," by week 5, and they're ready to give up, and then suddenly, "Oh, here we go, everything's
Yeah.
changing." Or 1 or 2 treatments really feel different, so relaxed,
Mm.
sleeping better, or joint pain has eased. Um, so really different. It's just so difficult to say. You can't tell when you meet someone how they're gonna respond. Um,
Right, okay. So
but,
there's no indicators that would say, "Yes, this would be
there's
a good
not.
person
There's not
for
really.
acupuncture," or, "This person wouldn't." It's just a
No.
question of,
No.
yeah, they
And
having the
I've actually
symptoms.
had really needle phobic people come in and be able to tolerate it. So, which is
Right.
surprising. You think, crikey, do you know what this treatment is? And then
Yeah.
once you get going, because they're so fine and you don't really feel very much.
Have you had it, Sarah?
I
Have you had
have,
it?
yeah, I
Yeah,
did,
I've never
but
had that
sadly
culture.
not regularly enough.
Yeah.
Yeah.
But yeah, so it was, yeah, that was another story behind that, but it wasn't
Yeah.
regular enough, I don't think, for me to massively feel the benefits
Yeah.
from it.
Mm.
But yes, I didn't find it
Yeah.
uncomfortable.
No.
I think the only one I had squealed a little bit was I think I remember somebody putting one in my toe.
It's making me go
I can't
funny.
remember why it was in my toe, but it was in my toe. It was only once, and
Yeah.
That was enough.
that one
Yeah.
made me squeal a
Yeah.
little bit.
You don't
But
have to do the toe.
yeah,
So you find yourself giving a lot of reassurance to people before they
Yeah.
actually come into the clinic to see you, and
Yeah.
just saying, "Come and give it a go and see how you
Come and give
feel."
it
As
a
you say,
go.
when
And
you've going through cancer treatment, you've got enough needles going in
yeah,
and out of you, haven't
absolutely.
you?
Yeah.
Yeah.
I'm open
Amazing.
for anyone to ring me and have a chat about it, see if they or before they come in. And like I said, you can do a lot of work even with, say, 6 tiny needles. You don't have to go. There are a lot of treatments. Say if you went to an osteopath or a physio, they would be
Mm.
doing needling on really stiff muscles or joint pains and stuff. They would be using bigger needles. So we're not doing that at all. We're very gentle in oncology acupuncture. So
Imagine,
and that's
yeah.
the key, isn't it? Because ultimately, when you are going through it, you want gentleness, and yeah, you don't. I
yeah,
don't think any more trauma is needed, and
yeah,
it's meant to be about trying to help somebody relax
yeah,
and not.
yeah.
Maybe it wasn't a toe, maybe it was a foot, but anyway.
Yeah.
Someone you didn't
It was
like.
something I didn't like, yeah, as you
With the
say, it
toe.
was
I think part
a part of my anatomy I wasn't very sure about.
But part of it is about having an open mind, isn't it? And
Yeah.
being open to trying things. I remember the first time I ever had reflexology, which is obviously based on pressure points as well. And I don't know the technical difference. I just remember going for it and enjoying it and falling asleep, because I fall asleep at
Mm.
the drop of a hat if someone's massaging me or rubbing my feet. And I remember coming back here to my home and sitting, and a few hours later, and it was literally like a big grey cloud came over me. I could actually visualize it and burst. And I sat there and cried. Doesn't sound very positive, does it?
Wow.
But it
No,
was so
it's really
cathartic. I sat
releasing.
there for a good half an hour just sobbing and felt
Yeah.
so much better. And I can't put it down to anything else. There was nothing else that had happened that day that would have brought on that kind of reaction. Oh my God, I felt so much better afterwards.
Mm.
So I wasn't expecting that. I was just feeling a bit down and thought I might do me some good,
Yeah.
So
It can
yeah,
be really, really powerful. There's a couple of points in the head and just here. And I've had a few clients who've really felt quite emotional when they've gone in, and as it sort of brings everything down, and they feel like hopefully that it's a safe space that they can really let go, and it can bring on quite a lot of emotion. So, like you said, it can be a release.
yeah. So do you
Um,
chat while you're what's the word? Acupuncturing? Not
Treating.
Doing
practicing your
needling.
art?
Yeah. Do you know what? Yes, I mean, a bit of both. We have a nice big chat on the first one and then just see what people want. I've got,
Yeah,
lovely relaxing music if they would like to just zone out. And for some people, that is literally the only time they're ever going to get any time away from the madness of life. And so they really want to just lie down and let the needles do their thing and listen to the music. But got a lot of people who don't actually talk to a lot of other people either. So again, they might see that as a 6 sessions of being able to chat about stuff all to do with oncology, but and needles and life in general. So just
yeah,
whatever they want, really.
yeah. So you can accommodate both. A
Yeah,
little bit like
you
massage,
don't.
isn't it?
Yeah.
People
Yeah,
ask
Yeah.
people how they
You're
want to
always
run.
client-led really,
Mm.
yeah,
in terms of how they want to, receive or have their treatment done.
yeah, yeah.
So what's the most dramatic response you've seen in somebody in all your time doing this?
Oh dear. Okay.
Well, you must have one that stands out, or maybe it was the first one you ever did, but what made you
A
go, "Oh,
dramatic
yeah,
a
this is where
dramatic
I want to
response.
be"?
Okay, no, I do know one. A chap came in, he was, on, medication for his prostate cancer,
Yeah.
and he was having 30 to 50 drenching flushes a day. Having to change his clothes,
Mm.
having to just life-changing, couldn't go out, felt really embarrassed, couldn't sleep.
Mm.
Um, and he was skeptical, really skeptical, but the clinical nurse specialist had said, "Come on, let's give it a try," because he really wanted to stay on his treatment. And he came in, and within 3 sessions, the third session, he came through the door, and he just had his arms out, and he was just like, "Come and give me a hug." And he said, "And it's a dry
Oh.
hug." um,
Oh,
and
That is
that's
it
life-changing,
amazing.
was
isn't
That's
it?
great, and it had
amazing.
gone down maybe to 10, and then we dropped it down to about 5, and he was happy with that
Fantastic.
because it was
Yeah,
so different. And he
yeah,
continues to come to the groups, in Eastbourne, and, he and a couple of other there was about 6 guys that all came, together, and they've become really close friends, and they've set up like a little network. They go to the pub, they go out socially, but they also come for their needling. So that was something really unexpected and just wonderful that they
yeah,
could all connect around that. And they did say that one session we were all there together, and they said, "We don't talk to anyone else, even our partners or families, like we do to each other." And
yeah,
so that was like one of the best things, I think.
yeah, fantastic. And do you find it is an equal number of, gender-wise, is it equal, or do you find there's more of one?
Maybe a few more women, but not as dramatically as you'd think. You'd think, "Oh gosh, a lot of men might poo-poo it," but actually, I'd say we're pretty even now.
Yeah. I mean,
Yeah.
hot flushes for women is awful enough, isn't it? And medically induced ones when you haven't had it anything, or when you have had it already. But but for men, it's I'm not going to say they have an easy ride through life because that's not true. But hormonally, they're more
Yeah.
stable, aren't they? And then
Yeah.
to have that must be really disruptive
Yeah.
to their lives. So that's
And
wonderful that you can
they're
bring
really
people
shocked. They're
together.
really shocked. Yeah,
Yeah.
they don't expect the emotional side of it either. They don't expect
Mhm.
to suddenly have the rug pulled out from under their feet and feels like anxiety and a lot of emotion. And that can be something that's quite challenging. They don't want to talk about it with anyone else. They feel like they're less of a man, whatever.
Yeah.
And so actually, that is something really important that they can share with each other.
And are they more sympathetic towards the women in their lives?
They are. They really are.
Well, there's a win, isn't it? Yeah.
Their wives are like, "Yeah, there you go. See, you
Yeah,
need to
yeah.
understand." But, yeah, they do.
That's an incredible result though, isn't it?
Yeah.
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 So with the NHS cancer plan, you know, maybe obviously I think there's a stated aim in there, isn't there, to have a more holistic care for each patient. Do you
Yeah.
think, I mean, I can't imagine your hope there'd be anything else that you would hope that this would extend to
Yeah.
other areas as well, and that more people would be able to access it.
Absolutely. That's
Yeah.
underpins everything for me, like an integrative approach. I think it's so important. And I think, well, I'm working on some stuff at the moment within the chemo unit to hopefully get some guidelines out there to help nurses as well, because I think we're not educated enough to help patients feel empowered to pick the right choices, the sort of evidence-based choices about mind-body therapies to help them through treatment. Traditionally, we were just, you deliver your chemo, here's your pills, off you go.
Mm.
But we really need to be saying there's other stuff that you can do, and maybe here's the right place to go, because otherwise it's a dangerous world of Google, isn't it? So if we could
Or
write some really
ChatGPT these
robust,
days.
sorry.
I said, or chat.
Yeah,
Yeah,
oh, yes.
ChatGPT.
Yeah.
Oh my gosh,
Yeah.
yeah, exactly. And I'm sure, of course, everyone's doing that, but it would be lovely to have some really robust
Mm.
guidelines that with great evidence-based signposting for people. Um, and so, yeah, that's something that's in the pipeline. Hopefully, get that
Fantastic.
through.
That
In
sounds really forward thinking as well, actually, because
Yeah.
I mean, half of what my work underpins is the mind body approach. So, I just think that's really exciting work,
Yeah.
actually. The medical side of things can adopt it, because often when I've been in the units, I don't see a lot of support always for that side of
Yeah.
things.
Yeah. Well, I don't know whether you've had experience of this, but I certainly have heard, you know, nurses maybe not because they don't have the information,
Mm.
not really talking to patients about diet or exercise because they just don't know. So, oh, well, maybe just rest and don't do anything. And now we know that clearly it really isn't what we need to be advising. So the more you hear things like that, you think, gosh, we've really got to get up to date here with what, is the best advice to
Yeah.
support well-being through treatment.
Absolutely. And I have to say, I'm going to give myself a little shout out here, because I'm actually
Yeah.
quite emotional and excited to hear about the Eastbourne acupuncture service, because when I did my fundraising for the Sussex Cancer Fund back in 2022, I raised about £20,000. And my
Oh my
understanding
gosh.
is that most of it went towards setting up the Eastbourne
Wow.
acupuncture service.
Well, thank you.
I will give myself a little shout
Yeah.
out, but actually it wasn't so much about that. It was actually the pride of hearing how, with that gentleman that you mentioned, how he's not only had the acupuncture and received such great results, how he's managed to form friendship and bonds, to support him at a time when he needed that support. So I'm actually feeling quite emotional about that,
Oh
because
gosh.
that's like a little success story from something that I did,
I'll
so
get
yeah.
so grateful because, and I'm so glad I didn't know I was going to tell you that today, but that obviously was meant to happen. So thank
Yeah.
you so much because that is directly, you've made that happen. So thank you.
Amazing.
Yeah, yeah. So thank you for myself. I'm really
Yay!
pleased.
Oh, that's lovely. That's a lovely way to finish things. Yeah. Yeah. So so you mentioned that so a referral needs to come from a medical professional. If no people can't self-refer, but
Yeah,
they
not
can.
at the moment. Yeah.
Yeah. But all the units have got your
Yeah, and
details
just to
and can refer
clarify as
in.
well, we got a little bit oversubscribed because word of the service got out to the general, GPs and all sorts, and then suddenly we were flooded. And we
Yeah.
thought, "Crikey, we really can't deal with
Imagine.
this." So it is for patients who are undergoing treatment. So by that we mean not just on not on an active, doesn't have to be a chemotherapy. It could be a maintenance tablet treatment, or it could be a hormonal treatment. If it was to be anyone who had had cancer or it would be huge.
Yeah. Yeah.
And
It's
so it has to
manageable.
be sort
Yeah.
of treatment related side effects, just to make that clear.
Okay. Yeah.
But
No,
of
that's
course,
helpful.
I will see anyone, so.
Fantastic. Well, thank you so much for coming on today. Would you like to share a last-minute top tip for our listeners?
Oh, last minute top tip. I just think that there's so many tools out there and it can be a bit overwhelming, can't it? Especially in this sort of expanding wellness industry, but also lots of tips for cancer patients. And where do I start and what do I do? Acupuncture is just another tool to add to your toolkit. There's so many things out there. But I think it's a really gentle, safe, and effective, potentially, treatment to try. So if you're curious at all, just give it a go and see if it might help. And like I said, always open for a chat if you want to ask some questions first. So.
And I'm sure if the people who are listening from all over the world and the UK, can obviously find other local practitioners, although obviously clearly not through the NHS just yet.
Yeah.
Hopefully that will come. But, we'll hopefully be able to sort of research and find a local practitioner who could be able to offer this service to them too.
Definitely. Yeah.
So, well, thank you
Great.
so much, Anna, for coming and sharing all these amazing benefits of acupuncture today for our listeners.
That's all right. Thank you for inviting me.
We're just amazing. What you've just said just blown my mind, that something so, well, seemingly simple, obviously it's not because it is science, but something that people can access so easily can be so effective and have such dramatic results. So
Yeah.
thank you.
Brilliant.
Thank you
All
very
right.
much.
Take care.
So,
both. Hope
this
to
is the
see
end
you.
of this episode of Your Way Now, and we'll see you again next time.
Thank you. Bye.
Thank you.
Get the strength you want and need from real stories and expert voices. It's time for Your Way Now.
Thank you for listening to Your Way Now. If you have a story you'd like to share, or would like to be a guest, or have ideas about what would be helpful to hear on future episodes, we'd really love to hear from you. Please remember you're not alone on this journey, and your voice really does matter. So until next time, this is Your Way Now.